and this is our weekly update on our pandemic, with our public health team, Dr. Kristina Toledo. Just so honored to call her a friend and for her to be one of our Lummi Public Health lead officers. Dr. Toledo, September 11th this week, what are our numbers looking like? And geez, there's a lot of smoke around too.
Thanks so much for having me, Freddie. It's always great to be with your show and to give the community an update. The numbers are looking pretty good for Lummi. The last case we had was back in the 14th, so almost a month here, no cases, so that's very exciting. I think that the whole state is doing pretty good, and Whatcom County as well, so that gives us a little more breathing room and decrease our risk here in the community as well if the surrounding communities are doing better. So far we had 59 positive cases, and those are not all tribal members. 45 of those were tribal members. We do test tribal members, relatives or employees of the tribe, so those other numbers account for that difference. We continue to test anybody who needs a test. We continue to encourage people to do their best to follow the social distancing guidelines, stay with small group of people, wearing a mask whenever you're in public, and avoiding traveling to areas where have high rate of transmission. Those are the things that you can do to keep yourself and your family or community safe. We are very grateful for all the sacrifices that people have done and all the help they have given us to keep the community as safe as possibly in this very trying circumstances that the whole world is going through right now. Lummi not being spared as no one is right now, unfortunately. Then moving on to the smoke, it's unfortunate and really sad that this is happening everywhere here in Washington State, with the smoke coming up from the Cascade area, from the east side, and as well as from Oregon, coming upwards towards us. This next few days is going to be pretty difficult. So we encourage everybody to stay inside as much as they can, because the outside air is not great. We did post some links in our Facebook. I think the communications also share for you to look where the air is worse. Right now it's considered not hazardous, but poor quality. So we encourage everyone to stay inside, especially people who has lung disease, people with COPD, people with asthma, who may be triggered with this bad smoke out there. So that's our encouragement. People stay outside. Try to, if you have air conditioning, have that running. Otherwise, you can consider putting some buckets of air, of water around your house to humidify the air a little bit. That should help too.
And then, Doctor, really quick, I know the county's been doing really well. The tribe's been doing really well. And I know, we're at phase 2.4.4, and, tribe's doing really good. People are doing really good. They're wearing masks, socially distancing, working from home. But, just briefly, are we looking at a phase 3 possibly?
That's a great question, Freddie. We're looking carefully and see. I think that it would be the most prudent to move in coordination with the surrounding communities. And I don't think they're quite there yet to move on to the next phase. So it's something to be seen the next couple weeks. We really want to move to phase 3, but we don't want to do it too quickly and set us back and put us at risk. What we're doing in the meantime is working with all the different sectors of society, schools, other different things, to trying to get them moving ahead first, opening up some of those things for particularly for kids, because I know it's been a big deal for a lot of families. So we've been working with some of the services with the Boys and Girls Club, trying to get some of the kids back to doing activities. I think before we move forward to phase 3. I have been talking with people from the surrounding counties. The hope is that we can get schools back open before moving on to phase 3, but that discussion is still ongoing. We are having our own internal discussions here. Hopefully we have a plan by before this extension of the last extension phase 3 expire. I think that is in the horizon, but obviously the flu season is here. It's coming up soon. So that obviously worries us. If you move too quick, then we'll have massive increase of cases. I don't know if you've been following what's happening in Europe. They did really well for a long time, but they reopened completely, and they are now having to shut down borders again. Spain is having just as many cases as they did at the height of the pandemic. So this is kind of unfortunate swing of things. As we've seen things getting better, we may have seen loss of some of those gains that some communities have done. So I don't have a full answer yet. We're still looking at all those parameters. My personal hope is that we get to open schools and get some of the kids back before we move on to other sectors of society, but that's still under discussion. I wanted to mention briefly, Freddie, because since I mentioned the flu, this season is very fundamental that everybody gets their shots, everyone. We're hoping the CDC hopes to immunize 65% of all the US population, which is probably more than any in the past. Because the fear is that we're gonna have this massive influx of COVID plus flu, and it may be like a double hit and then collapse of the health system, that kind of thing, like they saw in New York just with with COVID. So the hope is that we get as many people vaccinated as we can to prevent the flu to become a problem, to avoid people getting two potentially fatal viral infections at the same time. We have gotten our last batch that we were waiting of vaccines, so this week. So we are just working to start rolling them out. Next week, we're gonna do the employees of the clinic and anybody coming in and out. And then we're gonna start opening for the whole community on the 21st. And we're hoping that everyone, even young people that usually don't get their flu shots, will get it this year so that we don't give it to grandma and grandpa on top of the risk for COVID-19.
Dr. Kristina Toledo-Cornell, so good to see you, doctor. Thank you for our weekly update. And just to let you know, I got my flu shot today. So we love you. Thank you. Thank you to our Lummi Public Health team, and make sure you let everyone know the community appreciates everyone doing our civic duty to protect our families from COVID-19. So
thank you so much. Thanks for having me. It's always a pleasure, and I'm happy to come back anytime.
Nice guy.